Thank you for having me in your beautiful country. It's as warm as in Manila. So I'm used to the weather. So I would like to share with you a study I'm doing on Supracor presbyopic LASIK on pseudophakic eyes. So as you know, Supracor is a presbyopic algorithm that gives presbyopia or better near vision to presbyopic patients above 45 years old. So this study is sponsored by TPV or Technolas. The rationale for doing the study is, first, majority of our patients in any practice, I guess, still implant monofocal IOL. So no matter how much we try, not everybody will opt for a presbyopia correcting lens. These patients, no matter how good our biometry IOL master is, they may still have some residual refractive errors and astigmatism after the surgery. And then some of them may use glasses, some of them may not use glasses, but some of them still want to use distance vision glasses when they drive, when they watch TV. Most of them will end up needing reading glasses. And almost all of them, if you ask them, they would rather have no eyeglasses to see everything well. So there's a motivation to improve their lifestyle. LASIK has always been accepted as a way to correct residual error and astigmatism. LASIK has been used for corneas after phacoemulsification. So after ECCE, I usually don't do LASIK. I will prefer to do PRK because of the superior wound. I do a superior hinge flap, so I'm worried about doing a free cap. But for phaco, it's acceptable to do LASIK on them. And we are already using LASIK to correct patients who are not happy because of residual errors after any presbyopia correcting lens. So for example, you use multifocals, you use crystallens. If you are unfortunately off target, then to make the patient happy, you have no... I would rather do LASIK than do a lens exchange. So Supracor is, as I said, a presbyopia correcting algorithm designed by TPV. It uses an aberration optimized algorithm creating a multifocal cornea. So the central near addition is about 1.5 diopters to 2 diopters. In the mid-periphery, there's an aberration neutral transition zone, and distance correction is beyond the transition zone. So when a patient looks at distance, the pupil dilates, so the periphery comes into play, correcting for distance. When you read near, your eyes converge and the pupils constrict, so you're seeing through the central bump, giving you the near. So Supracor LASIK is already being used commercially for patients who are presbyopic, who have virgin corneas, who want to improve their near and intermediate vision without minimal degradation of distance vision. Because as you know, if you do monovision, you degrade or sacrifice distance vision. So the research question was, can Supracor be used in pseudophakic eyes with monofocal IOLs to improve near vision? So the main objective is to determine the refractive and visual outcomes of these pseudophakic patients after undergoing LASIK with Supracor algorithm. It's a prospective study. We are recruiting 35 to 45 patients. The patients have to be at least 45 years old with a monofocal non-accommodating lens. So if you have a crystal lens, we cannot enroll them in this study. They should have no intraoperative complications, so no vitreous loss, PC rupture. The spherical error should be between +2 to -2 with up to 2 diopter cylinder, and the best distance vision should be at least 20/25 to qualify for the study. And we check for glaucoma or retina problems beforehand. One eye of the patient will be treated. So in this study, we have to do one eye only. But in private patients, we can do both eyes. Eyes with a higher refractive error or poorer uncorrected distance vision is the one selected. So the eye with a poorer far vision is the one we do the treatment on. If both eyes have a similar uncorrected distance vision, then we do the non-dominant eye. So that's the way we choose which eye. We do a standard LASIK. We use a keratome so that we can avoid the prolonged healing of femto cuts. We use the SupraCore algorithm, and for all the tests, we use the Optec vision testers. We don't use Snellen charts. We use a vision tester for standardized lighting and size of the letters. So, we have done 10 eyes of 10 patients so far. The mean age is old, 68 years old. So, one patient was 75 years old. Pre-op MRSE was near plano. So if you do a good job in your phaco, most of your patients will be near plano. But they will still want no reading glasses. So these are the motivated patients to enroll in the study. I use BNL and Alcon lenses only in our clinic. So it's a mixture of different lenses. And the fellow eye was not treated. So the fellow eyes have a mean spherical equivalent of near plano as well. So, refractive outcomes. First, on this part, you see the mixture of pre-op refraction. Some of them are hyperope, some are myope, some are mixed astigmatism, and some are emmetropes. And the target is minus 0.5 diopters. So, we want them to be minus 0.5. And at 6 months in some of the patients and at 3 months in some of the patients, we're very close to target. So we want them to be slightly minus, not plano, so that there will be an additional kick for reading. So uncorrected distance vision of the treated eye is about 100% or at 0.8 or better. So 20-25 or better in all patients. No? In terms of intermediate vision, again, 0.8 or better, 100%. So everybody sees well for intermediate, whereas pre-op 70% see 0.6 and none of them see 0.8. And near vision, again, none of them see 0.8, only 20% see 0.63, but at 6 months, all of them see J2 or better. So, what about the gain and loss of line? So we want to determine safety. Are we causing them to lose best corrected distance vision? Some of them lost one line because of dry eye, but this is temporary. But none of them lost 2 lines or more. So the multifocality that we are causing in the cornea does not cause a significant loss of best corrected distance vision. So what can they read without glasses? Before surgery, none of them can read the newspaper or package inserts. In the Philippines, as in here, many people do text messaging, so only 30% can see their cell phone. At the end of the study, in some of them, they can see, most of them can see 100% without reading glasses. So, in terms of functionality, they're quite happy. They're watching TV without glasses, so we are not degrading their uncorrected distance vision. Night vision, we are not making their night vision or night driving worse. Surprisingly, if you think that the multifocality will affect night vision, remember in SupraCore, the central bump is only in the 1.6 millimeter center. Beyond the 1.6, there's no transition zone or there's no bump. So, when the pupil dilates, the mid-periphery, which is aberration neutral, does not cause glare or halos, unlike a hyperopic LASIK where the transition zone extends farther. So, the surgery was according to expectations, and they would recommend the surgery to their friends. So, interim conclusions is, we are not causing monovision. We're targeting slight minus but not monovision, and we achieve this. Near vision is well improved, intermediate vision is well improved, and distance vision is maintained or improved, and patient satisfaction is high. So, SupraCore will soon be a welcome addition to your practice to increase your current refractive base if you include your post-cataract patients who have monofocal IOLs. Thank you.